Welcome to the parshealthTV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to have 7 minutes about diet for acid reflux disorder, 5 best foods for acidity. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. The return of stomach acid to the esophagus is called gastroesophageal reflux disease, GERD, a chronic acid reflux condition. This condition occurs when the lower esophageal sphincter is weakened or severely damaged. The function of the lower esophageal sphincter is to prevent food from moving upward from the stomach to the esophagus. In this video, we are going to be sharing with you 5 the best foods for preventing acid reflux. If you suffer from GERD symptoms due to the high stomach acid volume, stay tuned to learn more about foods that reduce these symptoms. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. GERD symptoms appear due to an abnormal increase or decrease in the volume of stomach acid. They can be controlled to some degree by modifying eating habits. Number 5. Banana. A general recommendation for gastric reflux is to eat low-acid foods. Less acidic foods do not stimulate the production of stomach acid as much as acidic foods. Fruits are usually considered acidic foods, but some fruits, such as bananas, are not. If you have acid reflux, it is generally recommended to avoid eating citrus fruits and tomatoes because they are high in acid. Bananas are usually considered low-acid fruits, so eating this fruit is recommended for people with gastroesophageal reflux disease. Number 4. Pears, melons, and apples. Apples, pears, melons, and berries are low-acid fruits. Therefore, these fruits can be part of an anti-GERD diet. Using this food in your diet can have other benefits such as antioxidants, vitamins, and fiber. Number 3. Whole grains. Foods high in fat can stimulate gastric acid reflux, so eating low-fat foods is recommended for sensitive people. Adding whole grains naturally low in fat, such as oatmeal, brown rice, and whole grain bread, can all be part of an anti-reflux diet. Whole grains are naturally rich in fiber, vitamins, and minerals. Do not use processed and packaged cereals because they are high in fat and low in fiber. Number 2. Ginger. Ginger has been used for many years to treat various gastrointestinal problems, including nausea and stomach pain. Ginger also has anti-inflammatory properties. In a study, ginger consumption was shown to help reduce stomach ulcers, which is a condition that can be very painful when the acid causes inflammation in the stomach. Number 1. Vegetables. Vegetables are low in fat and high in fiber, anti-inflammatory. They contain antioxidants, vitamins, and minerals. Avoid high-fat cooking methods such as frying and not use too much sauce. Eating green leafy vegetables such as broccoli, onions, and asparagus are recommended because they are very low in acid. Adding fresh basil to your diet can also help improve gastric acid reflux. Recommendations. Here are foods and drinks that you should avoid. Even the foods mentioned above cannot guarantee that you will not have gastroesophageal reflux disease. But they can significantly reduce the risk of such a problem. Some foods can stimulate gastroesophageal reflux disease. In coffee, tea, energy drinks, and chocolates, Caffeine is one of the most harmful foods for GERD problems. Citrus and citrus juices. Spicy foods. Fried foods. Foods or chewing gum that tastes like mint nicotine. Other general recommendations for preventing gastroesophageal reflux disease include not lying down immediately after eating chewing gum. Do not consume large amounts of food in one meal. What does scientific research say about gastric reflux? No specific diet prevents stomach acid from returning to the esophagus. However, some foods effectively reduce the symptoms of gastroesophageal reflux disease in some patients. Scientific research has shown that increasing fiber intake, especially in the form of fruits and vegetables, effectively improves the symptoms of the disease. However, researchers still do not have complete information about how fiber prevents the symptoms of the disease. In addition to improving the symptoms of gastroesophageal reflux disease, increasing fiber intake also plays a role in reducing the risk of high cholesterol, uncontrolled blood sugar, hemorrhoids, and other intestinal disorders. Be sure to talk to your doctor about eating foods and drinks that are likely to make your symptoms worse. Remember that sometimes foods that reduce GERD symptoms in one person may aggravate the symptoms of the disease in another, but consulting a nutritionist will definitely help. See your doctor if you do not see any improvement in your diet or lifestyle changes. If you do not notice any significant improvement in your symptoms, your doctor will probably prescribe medicine for you. Doctors recommend surgery in very acute cases. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.